Hello, I am Dr. Major Pankaj Surange. I am the director of IPSC India. I am also the honorary secretary of Indian Society for the Study of Pain.
Thank you. Question number 2. Since how long have you been using cooled RF in your practice?
I started using cooled RF since last almost 4 years now. Before that, I was using conventional RF technique. There were some major indications where we actually stopped doing conventional RF, but in last 4 years when it came to India, cooled RF technology. So since then I'm using the cooled RF technology.
Thank you. Question number 3. What are the indications where you find cooled RF useful?
Indication wise, there are multiple, as I just mentioned that before 4 years when this technology was not there, we were using conventional radio frequency for most of the indications. But what we found that especially like in joints, we were having some difficulty in getting the results. The results were not that good with the conventional RF. So actually I had stopped using conventional RF for the joints. But since cooled RF has come, I restarted that, and I found that it's giving good results in the joints also. So currently in my practice, I'm using it for the joints, for the osteoarthritis of the knee, shoulder joints, and for the biacoplasty for the discogenic pain. So these are the 3 indications in my practice.
Thank you. तो pause लेना है पानी पीना आराम
नहीं ठीक है ठीक है
ठीक है
हाँ
So you
फ्लो में
want to
चलें.
continue, want to reframe the first second if you are comfortable. Okay?
I'm okay.
Okay, right?
एक फिर से उसको वेट करना है.
नहीं
नहीं सही जा रहा है, सब सही जा रहा है.
ठीक है. Question number 4. In your experience, how does cooled RF provide benefit in treating chronic discogenic pain of the lower back? Kindly brief on the advantages of cooled RF bipolar treatment.
So for the discogenic pain, our main concern was that since last a decade, we have seen a drastic increase in the incidence of the discogenic pain, and especially in the patients who are young patients, because of the long sitting hours and prolonged drivings. All these are the factors which have really increased the incidence of the discogenic pain in the younger population. We have been struggling with managing these patients with the discogenic pain because if you see the MRI, it looks almost normal and they have just a minor abnormality on the MRI. So people never used to consider that as an abnormality, and we used to manage them conservative. We used to do multiple other techniques which came for the management of discogenic pain. But since as I mentioned, since last 4 years, I started using this technology of the bipolar cooled RF technology. The most important indication what I found with the cooled RF is the disc repair or the disc for the management of the discogenic pain. The biggest advantage what I found is a non-surgical technique, as we all know. It's a very simple, easy to learn also, and it is quite effective. When we talk about the technology, what is most important for us is that whether this technology is required or not. So we definitely need a technology where we can manage patients who are suffering from the discogenic pain, especially the younger populations. We cannot let them undergo big surgeries, fixation surgeries for such a minor issues. So non-invasive or less invasive techniques are the most important thing for us to manage these conditions. And this technology, the cooled RF technology, the bipolar radio frequency or the biacoplasty, that has given us a room for treating such kind of patients.
8 minutes. Hold your hand. एक भी करो क्या हो गया? वहाँ पे लगेगा जो कार्ड लगाने के लिए. कौन सा? इसका नंबर. वीडियो तो अच्छा है. इसमें जाने पर चलता है ये ना.
एक बार प्ले करके दिखा दो.
छोटा स्क्रीन है पर व्हाट्सएप करना है.
And
सारे कैमरे में रिक्वेस्ट ऑफ 1 मिनट.
Question number 5. In your experience, what is the patient selection criteria to consider for this biacoplasty treatment?
Patient selection is the most important aspect of any technology, any treatment, whatever we are deciding for the patient. We cannot jump on the any intervention just because we have a technology available and we can perform the procedure. like before that, before a decade back, for the discogenic pain, we used to do fixation, right? Because I know fixation, how to do fixation. We cannot just jump on the fixation. So that is the most important criteria. The young pain physician, they should look into this, that they are selecting the right patient for the right technology. In my experience, what I have seen is that these are the patients who have failed conservative management for the discrete pain, who are having annular tears. It is not bulging and compressing the nerve. So these are the right indication for the bioplasty or the disc repair procedure.
Thank you. Question number 6. In your experience, what is the duration of pain relief with cooled RF treatment?
The duration of the pain relief with the bioplasty, what experience I have of last 4 years, since 4 years I've been doing this procedure. Uh, I have not seen any patient who has come back with the similar kind of pain or with the similar complaints. Uh, so far, it's been, I can say that, because we do not have huge experience, it's just 4 years of experience we have. In last 3 to 4 years, I have not seen any patient returning back with the same problem. So I can say that it's a long term. It's a long term for us. Yes.
Okay. Thank you. Question number 7. What is your recommendation on post-procedure protocol to improve patient outcome?
Uh, Whenever we use any technology, whenever we do any intervention or any surgery, post procedure is the most important time when we should be telling the patient the right things to do. Uh, Normally, what we do is that once the procedure is done, we don't advise any exercise protocols to the patient. Especially, it is very important for the patient with the discogenic pain, who are suffering from the discogenic pain. In these patients, when we do the procedure, after the procedure, it takes some time for its healing effect. When we are doing the disc repair with the use of bioplasty or the annuloplasty, it doesn't happen that it suddenly immediately it becomes very strong. It takes some time for the granulation tissue to form over there. So this takes around 3 to 4 weeks of time. So these initial 3 to 4 weeks is a crucial time. Patient may have a very good pain relief maybe next day also, but for the long term effect, the post procedure advice is the most important thing. Normally, in my practice, what I advise to the patient, just take 1 or 2 days of rest, because there will be some stiffness, because it's an invasive procedure. There may be some stiffness for 2 to 3 days. Usually, I advise them to join their duties after third day, and then they'll have to take all the precautions whatever they were taking before the procedure. Like, they should not lift heavy weights, they should not bend forward, they should not sit for long time. Another thing is important is, you must advise them that they should go for the regular walks. You should not ask them to go for the rest. Rest is not required in these procedure. Rather, we want them to be more active after the procedure.
Okay. Thank you. So last question. What is your experience with the latest cooled RF generator?
Uh, I used the earlier one also, and the new machine which has come. I think I'm the first one to buy this machine in India. Uh, Definitely, I have seen a good difference in the functioning of the machine. More effective, I can say, more effective than the previous generator. The biggest advantage what I found in this is that we can do 4 lesioning at a time. But earlier, that since we have different wattages for the each probe, we have a different wattage. So that is the division they have given in this new machine. So that is the biggest advantage what we are seeing. Suppose if the one of the lesion is not working properly, or there is some problem in the one of the probe, in that case we can actually stop that probe without disturbing the other areas. So we can continue with the 3. Suppose if you are doing a bilateral radiofrequency or the facet arthropathy, if one is not functioning properly, we can stop that, but rest we can continue. So that is one of the biggest advantage. Second, yes, definitely the look wise is really good. The touch screening is there, that is also really good. Earlier, what we have seen in the earlier machine, that there was some problem in the, suddenly it used to stop in between, and because of it was used to show some high impedance. But that we are not seen over in this machine. We are not faced that kind of problem with this machine.
Thank you. Thank you. Done. Done, sir. Perfect.
Wait. ठीक है। एप्पल में बहुत अच्छा कॉल। हाँ उसका माइक बुक पे है। ठीक है स्टार्ट कर सकते हैं।
ब्लूटूथ अच्छा है इसका।
Start. Question. What are the advantages of cooled RF over standard RF?
The conventional RF, the standard RF, we have used since last more than 2 decades now. We have found it as really very effective, but in some areas we had some limitation with with the conventional RF, like when this genicular branch for the ablation for the osteoarthritis knee. We started using this technique with the conventional RF, but we had a lot of failures in the with the conventional RF. So actually, my practice, I had stopped actually doing genicular RFA because of this limitation with the conventional RF. When cool RF came, we saw that it's a bigger reason, because the biggest issue is with the genicular RF or the procedures in the joints is the location of the nerve. It is difficult to see those nerves. We cannot find out these nerves. So we had to go as per the guidance of the fluoroscopic guidance. So that was the biggest disadvantage of the conventional RF, that we don't know exactly where is the nerve lying and whether we are sitting over the nerve or not. So that is one advantage which cool RF gave us, that we can cover a larger area. So suppose if we are going with the fluoroscopic guidance with the anatomical relationship, and we can cover that nerve with the cool RF. Similarly for the discogenic pain. Discogenic pain I never did, but yes, I heard that people started using conventional RF for the discogenic pain. So there is no point of doing conventional RF in the huge disc. It's a very big, it's a big tissue. In that tissue, we know that conventional RF has only very limited lesion size. So it is not possible, it's just not possible. And so we have the literatures also, they are suggesting that it's a negative recommendation. We should not do conventional RF inside the disc. Bicoplasty, when this cooled RF came, we started doing this technology, and we found excellent results with that. Normally, I'm very choosy about selecting the procedure and selecting the technology. But when we see personal experience, when we go with the personal experience, I found this cooled RF is much better in some areas as compared to the conventional RF.
Thank you.
It's like bang on.
Cut.